I'm very humbled and honored to receive this award from ACNL. The COVID pandemic was very difficult and there was a lot of challenges, but this also gave us a great opportunity for my healthcare team to really get creative on how we deliver care. This award only comes to me because of the amazing leadership team I have and I get to lead, and the collaboration from physicians and our respiratory partners. From the beginning of the pandemic, after seeing what our peers went through on the East Coast, we knew that we needed to make sure that our staff were always safe no matter what position they were placed in. Leading an ICU team, we were seeing the sickest and the most complex patients. We quickly identified that code blues were going to be the highest exposure risk for our staff and knew we had to rethink our approach. We developed a process to decrease the number of people in the room during a code to only 5. And we brought in technology using earbuds to create hands-free communication between the team that was inside of the room and the team that was outside of the room. We also wanted to make sure that we had the right PPE for our staff at the right time. So we created a PPE cart that responded to all code blues to ensure that staff never had to question whether they needed to put their life at risk with exposure to COVID versus saving a patient. We also collaborated with our respiratory therapist team and created a COVID navigator that collaborated with our ICU rapid response team. And we surveyed all the patients or surveillanced all the patients out on the floor to ensure that they were safe and they were getting transferred to the ICU at the right time if needed, so that we never had to code any COVID patients out on the floor. And I'm happy to report that for 18 months, we did not have a single COVID code blue outside of the ICU. Proning patients was also the #1 treatment for our COVID patients in the ICU, and we were able to create a team that would manually prone patients in 6 minutes or less because we had standard time, and we created a QR code video for anyone that was helping us so that they would be able to see how we actually do manual proning. Again, thank you so much for this acknowledgement, and I proudly accept this award, not only for me, but from my team, my leadership team, physician team, respiratory team that collaborated with me throughout the pandemic. Thank you.